Next group of special test is going to be for the anterior rotary instability, also referred to it as Alary or Amory. And first one that we're going to be doing is called the Slocum drawer test. For this one, we're going to have the patient in a supine position with their leg extended. And the athletic therapist is going to be down towards the feet. And what we're going to, and again, we want his leg close to the edge of the table. And what we're going to do is we are going to flex the knee to 90 degrees of flexion. And just like the anterior drawer, his hip is at 45 degrees. Likewise, we're going to sit on his foot in this position, and then we're going to what we're going to do is we are going to internally rotate the tibia before we do that. So his foot and tibia is angled inward, and then we're going to sit on the foot. And then for this one, just like the anterior drawer, we're going to grasp the proximal tibia and we're going to draw that anteriorly. Again, we have internal rotation. And what we're feeling for that one is going to be for your Alary structures. So it could be your anterior cruciate ligament, your posterior lateral capsule, your lateral collateral ligament, your IT band, or your popliteus tendon. Then we're going to externally rotate the tibia. Again, sit on it, again keeping it at 90 and 45 degrees at the hips, grabbing the proximal tibia with the thumbs around the tendon, both sides of the tendon. And again, we're going to apply an anterior translation, assessing the anterior medial instability. Specifically, if that's positive, that would be for an anterior cruciate ligament, anterior medial capsule, or the medial collateral ligament. Next special test that we're going to be doing is called the lateral pivot shift test. This is also referred to as the Test of MacIntosh. And this is also to assess Alary instability. And for this one, the patient is going to be supine with their leg extended. The athletic trainer is going to be down by the distal tibia. And for this one, what we're going to do is we are going to passively flex the hip to about 30 degrees, and then the athletic trainer is going to grasp the ankle, and we're going to, and then the other hand is going to be on the lateral side of the knee joint, also to stabilizing the distal leg or proximal tibia. And what we're going to be doing is with the lower hand, we're going to be applying a internal rotation of the tibia for about 30 degrees. And then what we're going to be doing is we are going to be applying a valgus stress test here at the knee while maintaining the internal rotation and a 30 degrees flexion. And then we're going to slowly flex it from 5 degrees to about 30 or 40 degrees of knee flexion. And we're going to be doing that slowly. And if it's a positive, the tibia is going to reduce or give away, or it might jog backwards. Any of these would be a positive sign for Alary instability, including the anterior cruciate ligament, the posterior lateral capsule, the accurate ligament, the lateral collateral ligament or the IT band. Special test that we're going to be doing is called a jerk test, and for this one the patient is going to be supine, and the athletic trainer, like the previous tests, we're going to grasp the foot with one hand, and the other hand is going to be on the lateral knee joint to help support it. What we're going to do is we're going to flex the knee to about 45 degrees of flexion, and then when we test it, we're going to flex the knee to about 90 degrees right there, and then and while we extend it, we're going to apply a valgus stress test, okay, and internally rotate the tibia. So we're going from 90 down to 0 degrees, and at about 30 degrees of flexion, the tibia will shift forward, causing a subluxation of the lateral tibial plateau with a jerk or a clunk. And this is a positive for a anterior lateral rotary instability. Special test that we're going to be doing is called a Slocum Alary, A-L-R-I test. And for this one, the patient is going to be lying on his side with the uninjured leg at the bottom. The hip is going to be flexed. Hip and knees are flexed kind of out of the way or off the table. And then the injured leg is going to be up here on the top. And what we're going to be doing is we're going to stand behind the patient at the level of the knee. And what we're going to do is we're going to grasp the knee at the distal femur, as well as on the proximal fibula or tibial. And what we're going to be doing, and the foot is going to be resting on the anteriorly against the table for stability. And then what we're going to do is we are going to apply a valgus force towards the table. I also wanted to mention that the knee is flexed to about 30 degrees of flexion, and this causes the as we apply our valgus stress, this causes it to move into about 30 flexion at 30 to 50 degrees. And what I'm looking for is a clunk or instability on the lateral tibial plateau as it subluxes, or pain. That would be a positive sign for any of our Alary, A-L-R-I structures, our IT band, biceps femoris tendon. The next special test that we're going to do is called the Flexion-rotation drawer test. It's also referred to the Noyes test. And for this one, the patient is going to be supine, starting off with the leg extended. The athletic trainer is going to stand lateral and distal to the injured knee. What I'm going to do is I'm going to hold the patient's ankle between my trunk and my elbow with both hands stabilizing the tibia. And then what I'm going to do is I'm going to lift the calf and ankle to flex the knee to about 25 degrees of flexion. And then I'm going to displace the tibia posteriorly to the femur. I can also do this with the knee flexed if I want to modify it. And then what I'm looking for is to see if the femur relocates itself or moves anterior and internal rotation. And this, if so, then this is a positive sign for Alary rotary instability. Next special test that we're going to do is called the crossover test. And for this one, what we're going to do is we're going to have the patient stand with their shoes off, and the injured leg athletic trainer is going to stand close to them to help support the patient. And what we're going to do is we're going to stand on, the patient is going to stand on the injured foot for stability, and then ask the patient to rotate the torso away from the injured leg to about 90 degrees. And for this one, from a fixed foot. So for the first one, we're going to assess the Alary structures. So for this one, we're going to ask the patient to cross the uninjured leg over the front of and across from the injured leg. Okay. So again, this is testing Alary structures, A-L-R-I, anterior, lateral, rotary instability. And that would be a positive sign for those structures. And then we're going to have them go back to normal, and then we're going to have them, for the Alary test, we're going to ask the patient to cross the uninjured leg behind and across to the other side. And then again, we're looking for if there's any pain or instability for this one, or apprehension by the patient. It could either, for either of these tests, you can go ahead and stand up. The Alary, it would be for, or the lateral structures, or the Amarys for the medial capsule.